afternoon, students. The topic of our first lecture today is development of normal occlusion. Why do we have to study this? To familiarize the normal development changes of occlusion from infancy to adulthood, to differentiate between normal and abnormal in occlusion that need intervention to prevent development of more severe forms of malocclusion. Development of occlusion. Dental occlusion undergoes significant changes from birth until adulthood and beyond. This continuation of changes in the dental relationship during various stages of the dentition can be divided into four stages. First, gum pad stage, from 0 till 6 months. Second stage, deciduous dentition, from 6 months till 6 years. Third stage, mixed dentition, from 6 years till 12 years. Fourth stage, permanent dentition, from 12 years and beyond. Predental period, period of newborn. The period after birth during which the neonate does not have teeth. This period lasts for 6 months. The alveolar arcs of an infant at the time of birth are called gum pads. These are greatly thickened olar mucous membrane of the gums, which soon become segmented, and each segment is a developing tooth site. Jaws are devoid of teeth at birth. Gum pad stage extends from birth up to the eruption of first primary tooth. Usually, the lower central incisors at around 6 months of age. The gum pads are pink in color and firm in consistency. The maxillary gum pad is horseshoe-shaped and the mandibular gum pad is U-square-shaped. The gum pads develop in two portions, labial, buccal, and lingual, which are separated from the dental groove. It starts at the incisive papilla, extends backward to touch the gingival groove in the canine region, and then moves laterally to end in the molar region in the upper gum pad, and this dental groove joins gingival groove in the canine region in the lower gum. The gum pads in both the arches show certain elevation and grooves that outline the portion of various primary teeth which are still developing in the alveolar ridges. These are called as transverse grooves. Transverse grooves separate the gum pads into 10 segments. The prominent transverse groove separating canine and first deciduous molar segments in both the arches is called the lateral sulcus. The lateral sulci are often used to judge the inter-arch relationship at a very early stage. The gingival groove separates the maxillary and mandibular gum pads from the palate and floor of the mouth, respectively. Characteristic features of gum pad stage. Infantile open bite. Usually, the anterior segments of the upper and lower gum pads do not approximate each other with a space created between them, while the posterior segments occlude with each other at the molar region. The tongue is positioned in this space between the upper and lower gum pads during suckling. This infantile open bite is transient and gets self-corrected with the eruption of deciduous incisors. Complete overjet. The maxillary gum pad is usually larger and overlaps the mandibular gum pad both horizontally and vertically, with a complete overjet all around. In this way, the opposing surface of the pads provides an efficient way of squeezing milk during breastfeeding. Class 2 pattern, with the maxillary gum pad being more prominent. Mandibular functional movements are mainly vertical and to a little extent anterior-posterior. Lateral movements are absent. Anterior-posterior relationship. In general, the mandibular lateral sulci are more posterior to the maxillary lateral sulci. Precocious eruption of primary teeth, natal and neonatal teeth. Usually, jaws are devoid of teeth at birth. However, occasionally, infants are born with one or two erupted teeth, usually the mandibular incisors. Such teeth present at birth are called as natal teeth. Teeth that erupt within 30 days of life are called as neonatal teeth. Familial tendency is observed in this condition, and such premature eruption of teeth may cause problems during feeding. It is advised to retain them unless they are too mobile. Deciduous dentition stage from 6 months till 6 years. The deciduous dentition stage spans from the time of eruption of primary teeth until the eruption of the first permanent tooth around 6 years of age. Eruption chronology of primary teeth. Eruption of the primary teeth begins from 6 months of age when primary mandibular incisors erupt into oral cavity. Eruption of all the primary teeth is usually complete by 2.5 years, by which age the deciduous dentition is in full function. Root formation of primary teeth is usually completed by 3 years of age. Although considerable variation is seen in the eruption timing of deciduous teeth, there appears to be no significant gender differences. The sequence of eruption of primary teeth may also show some variation. However, in most of the cases, the lower center incisors are the first teeth to erupt, followed by the upper central incisors. Usually, the lateral incisors, first molar and canine, tend to erupt earlier in the maxilla than in the mandible. A deep bite, absence of spaces may occur in initial stages of development. The upper deciduous frontal teeth cover the lower ones by more than half length of the lower teeth crowns. The tubercle of the upper deciduous canine tooth crowns is located between the lower deciduous canine tooth and the first deciduous molar. The mesial buccal tubercle of the upper deciduous second molar is located in transverse fissure of the similar lower tooth. The buccal tubercles of the upper lateral teeth cover the buccal tubercles of the lower ones, and the palatine tubercles of the upper teeth are located between the buccal and the lingual tubercles of the lower teeth. Teeth arches have shape of semicircles. Functions of the dental system are breathing, should be nasal, chewing, developing to the 3 years old, swallowing, after eruption of temporary incisors, a mixed type, tongue at the moment of starting push on incisors, by 3 years old, somatic type, speech fully formed by 3 years old, and sucking, dying by the end of the first year of life. I'd like to highlight the substage of deciduous dentition at the age of 4.5 to 6 years. The jaws start to prepare for the permanent dentition. Characteristics of occlusion of deciduous dentition. Interdental spacing when present in permanent dentition is considerable abnormal. However, presence of interdental spacing is an important and normal feature of deciduous dentition, which is required for the accommodation of larger permanent teeth at a later stage. Spaces present between deciduous teeth are often referred to as physiologic or developmental spaces. Sufficient interdental space is needed for the permanent teeth to erupt into an uncrowded position and for the establishment of their proper alignment. Malocclusion with crowding of teeth can be expected in cases of unspaced primary dentition. Physiologic developmental spacing is deciduous dentition include generalized spacing between teeth and primate spaces. Generalized spacing. According to Foster, 1982, generalized spacing occurs in almost 75% of the individuals in the primary dentition stage. Generalized spacing between the teeth are seen in both the dental arcs and helps in accommodation of larger successors teeth. Primate spaces, anthropoid spaces, or simian spaces. In addition to the generalized spacing, localized spacing is often present, mesial to the upper canine and distal to the lower canine. Such spaces, originally described by Lewis and Lehman, are a normal feature of the permanent dentition in the higher apes, primates, and are present in the human primary dentition. These are usually referred to as the anthropoid spaces. Anthropoid spaces appear to be a more constant feature of the deciduous dentition. Significance of anthropoid spaces following eruption of primary first molars. When canine teeth erupt and reach occlusion, the primary spaces facilitate proper interdigitation of the opposite canines into class first canine relationship. Incisor relationship. Incisor relationship in deciduous dentition normally show increased overbite, deep bite, increased overjet and deep bite. An increased overbite is usually seen in the initial stages of development with the deciduous mandibular incisors contacting the cingulum area of the deciduous maxillary incisors in centric occlusion. Deep bite may be due to the fact that the primary incisors are more vertically placed than the permanent incisors. The ideal position of the deciduous incisors has been described as being more vertical than the permanent incisors, with a deeper incisal overbite. This deep bite later gets self-corrected by attrition of incisors, eruption of deciduous molars, and differential growth of the alveolar processes of the jaw. Increased overjet is excessive incisal overjet is often observed in deciduous dentition. 72% of children exhibited an increased overjet in a study conducted by Foster. Excessive overjet usually gets corrected later by forward growth of the mandible. Space relationships in replacement of canines and primary molars. In contrast to the anterior teeth, the permanent premolars are smaller than the primary teeth they replace. The mandibular primary second molar is the average 2 mm larger than the second premolar, while in the maxillary arc the primary second molar is 1.5 mm larger. The primary first molar is only slightly larger than the first premolar, but does contribute an extra 0.5 mm in the mandible. The result is that each side in the mandibular arc contains about 2.5 mm of what is called leeway space, while in the maxillary arc about 1.5 mm is available on the average. When the second primary molars are lost, the first permanent molars move forward, that means mesially, relatively rapidly, using the leeway space. This decreases both arc length and arc circumference, which are related and commonly confused terms. Even if incisor crowding is present, the leeway space is normally used by mesial movement of the permanent molars. An opportunity for orthodontic treatment is created at this time, since crowding could be relieved by using the leeway space. Molar relationship. The anterior-posterior molar relationship in deciduous dentition is described in terms of the terminal planes. Terminal planes are the distal surfaces of the maxillary and mandibular second primary molars. Determining the terminal plane relationship in the primary dentition stage is of great importance because the erupting first permanent molars are guided by the distal surfaces of the second primary molars as they erupt into occlusion. Thus, the terminal plane relationship of primary dentition largely determines the type of molar relationship in the permanent dentition. Morse described three possible kinds of primary molars relationships: straight flush terminal plane, mesial step, distal step. Flush terminal plane. In straight flush terminal plane, the distal surfaces of the maxillary and mandibular second deciduous molars are in the same vertical plane. It is of significance to note that the mandibular second primary molar has a greater mesodistal diameter than the maxillary second molar. This difference in the dimensions makes the distal surfaces of both maxillary and mandibular deciduous second molars to fall in same vertical plane in centric occlusion. Such an arrangement is called as flush terminal plane. Flush terminal plane is considered to be the ideal kind of molar relationship in the primary dentition. Major step: in this terminal plane relationship, the distal surface of the mandibular deciduous second molar is more mesial to the distal surface of the maxillary deciduous second molar. Distal step: here, the distal surface of the mandibular deciduous second molar is more distal to the distal surface of the maxillary deciduous second molar. In other words, the maxillary second deciduous molar is ahead of the mandibular second deciduous molar. Mixed dentition stage from 6 till 12 years. Mixed dentition stage is a transition stage when primary teeth are exfoliated in a sequential manner, followed by the eruption of their permanent successors. This stage spans from 6 years to 12 years of age, beginning with the eruption of the first permanent tooth, usually a mandibular central incisor or a first molar. It is completed at the time the last primary tooth is shed. Significant changes in occlusion are seen in mixed dentition period due to the loss of 20 primary teeth and eruption of their successors' permanent teeth. Most malocclusions are developed at this stage. Mixed dentition stage can be divided into the following phases. First, early transitional period, inter-transitional period, second, late transitional period. Early first transitional period from 6 till 8 years. Early transitional period is concerned with the replacement of the primary incisors by their successors and the addition of 4 first permanent molars to the dentition. This usually occurs in the age range of 6 to 8 years. Emergence of the first permanent molars. The first permanent molars erupt at 6 years of age with mandibular molar preceding the maxillary molars in most cases. The first molars are considered to play an important role in the establishment of occlusion in the permanent dentition, and class first molar relationship is considered as the normal anterior-posterior molar relationship. The location and relationship of first permanent molars is influenced by the presence of interdental spacing and the terminal plane relationship of the primary dentition. The erupting first permanent molars are guided by the distal surfaces of the second primary molars as they erupt into occlusion. Thus, the terminal plane relationship of primary dentition largely determines the type of molar relationship in the permanent dentition. Among other factors, the effects of terminal plane relationships are described in Figure 8. Effects of Flush terminal plane. Flush terminal plane usually develops into class first molar relationship in the permanent dentition. Some cases of flush terminal plane may also develop into class second molar relationship if forward mandibular growth is not sufficient. In the presence of flush terminal plane, the first permanent molars initially assume a cup to cusp or end-on molar relationship as they erupt distal to the second primary molars. The lower first permanent molar has to move 2-3 millimeters anteriorly in relationship to the upper first permanent molar in order to transform the end-on relation to class first molar relation. This transformation from end-on to class first molar relation occurs in two ways: early mesial shift and late mesial shift. Early mesial shift of lower permanent first molar occurs by utilization of the physiologic space present between primary incisors and the primer spaces. The eruptive force of permanent molars pushes the deciduous molars forward into these spaces, thereby establishing class first molar relationship. As this change occurs in early mixed dentition, the shift is called the early mesial shift. Late mesial shift. In the absence of sufficient developmental spaces in primary dentition, the erupting permanent first molars may not be able to establish class first relationship in early mixed dentition period. In such cases, class first molar relationship can be established following the exfoliation of primary second molars by utilizing leeway space. As this occurs in late mixed dentition, it is called as the late mesial shift. Effects of mesial step. When deciduous second molars are in mesial step, the first permanent molars directly erupt into class first molar relationship. Few cases may also progress to class 3 molar relation if forward growth of the mandible persists. Effects of distal step. Distal step in primary dentition usually leads to Engel's class 2 molar relationship in the permanent dentition. A few cases may go into first class molar relationship. Eruption of permanent incisors. Permanent incisors erupt lingual to the primary incisors, and mandibular central are often the first to erupt. How the larger permanent incisor teeth are accommodated is described below. Incisal liability. It can be readily appreciated that the mesiodistal crown dimensions of permanent incisors is considerably greater than that of the primary incisors. This difference in the mesiodistal crown dimensions between the primary and permanent incisors is termed as incisal liability by Warren Main. Incisal liability in maxillary arches is about 7.6 millimeters. This is the maxillary permanent incisors are larger than their predecessors by 7.6 millimeters, while incisal liability in mandibular arch is about 6.0 millimeters. that is, mandibular permanent incisors are 6.0 millimeters larger than their predecessors. Thus, the amount of space available in the arch following exfoliation of the primary incisors is far less than the amount of space needed for accommodation of their permanent successors. Some degrees of transient crowding may occur due to incisional liability at about 8 or 9 years of age and persist until the emergence of canines, when the space for teeth may again become adequate. During the course of mixed dentition period, nature makes some adjustments to achieve the fit and maintain the dynamic balance. The major liability is overcome by the following factors: utilization of interdental spacing between primary anteriors. Incisional liability is partly compensated by the developmental spaces that exist in the primary dentition. Interdental physiologic spacing in the primary incisor region, 4 millimeters in maxillary arch, 3 millimeters in mandibular arch. Anterior crowding of permanent dentition may develop in the absence of interdental spacing. Increase in the intercanine arch width. Continuing growth of the jaws often results in an increase in the intercanine arch width during the mixed dentition period. This may significantly contribute to accommodation of the bigger permanent incisors in the arches. Change in incisor inclination. The deciduous incisors are more vertically positioned than the permanent incisors. Permanent incisors exhibit a more lateral inclination. This means increasing the interincisal angle from about 150 degrees in the deciduous dentition to 123 degrees in the permanent dentition, which tends to increase the dental arch perimeter. The change in the labiolingual inclination of incisors also contributes to overcome the incisal liability by adding 2-3 millimeters to the arch. Ugly duckling stage, broadband phenomenon. Around the age of 8 years, a midline diastema is commonly seen in the upper arch, which is usually misinterpreted by the parents as a malocclusion. Crowns of canines in young jaws impinge and developing lateral incisor roots, thus driving the roots medially and causing the crowns to flare laterally. The roots of the central incisors are also forced together, thus causing a maxillary midline diastema. The period from the eruption of lateral incisors to canine is termed as the ugly duckling stage. It is an unaesthetic metamorphosis which eventually leads to an aesthetic result. With eruption of canines, the impingement from the roots shifts incisively, thus driving the incisors crowns medially, resulting in closure of the diastema. Intertransitional period. After first permanent molars and incisors establish occlusion, there is an interim period of 1-2 years before the commencement of second transitional period in which little changes in the occlusion is seen. This phase of mixed dentition stage is relatively stable with only minor changes taking place and is referred to as intertransitional period. Late second transitional period from 10 till 13 years. The second transitional period involves replacement of molars and canines by the premolars and permanent canines respectively, and the emergence of second permanent molars. Exfoliation of mandibular primary canine at around 10 years of age usually makes the beginning of second transitional period. Eruption of permanent canines. Mandibular canines erupt following the eruption of the incisors at around 10 years, while the maxillary canines usually erupt after the eruption of one or both the premolars at around 12-13 years. Eruption of the premolars, the important portion of the dental arch in the development of occlusion, is the premolar segment. This is because the erupting premolars are significantly smaller in mesial-distal dimension than the primary molars which they replace. Thus, major changes in occlusion are observed during the premolar emergence. Eruption of permanent canines and premolars usually occurs after a pause of 1-2 years following incisor eruption. The first posterior teeth to erupt are the mandibular canine and first premolars 9-10 years, followed by maxillary premolars and canines around 11-12 years. Most common eruption sequence is 4-5-3 in the maxilla and 3-4-5 in the mandible. Favorable occlusion in this region is largely depends on favorable eruption sequence, satisfactory tooth size available space ratio, attainment of normal molar relation with minimum dimension of space available for bicuspids. Leeway space of none. In general, the combined mesial-distal crown dimension of the primary canine and primary first and second molars is greater than the combined mesial-distal crown dimension of their successors, namely permanent canine and first and second premolars. The amount of space gained by this difference in the posterior segments is termed as the leeway space of nuns and is present in both the arches. Leeway space of nuns is the combined mesial-distal width of deciduous canine first and second molars is more than that of the combined mesial-distal width of permanent canine first and second premolar. The difference between the two is called the leeway space. Maxilla 0.9 mm per segment is the same as 1.8 mm total. Mandible 1.7 mm per segment is the same as 3.4 mm total. Significance of leeway space of nuns. Presence of excessive leeway space is a favorable feature which provides for the mesial movement of the permanent molars. Leeway space in the mandibular arch is more than that of the maxillary arch. This is because the primary mandibular molars are wider than the primary maxillary molars. The leeway space differential between the two arches causes the mandibular first molar to move mesially relatively more than the maxillary first molar. Such an arrangement causes a change in the molar relationship from end on in the early mixed dentition period to class first ratio at the late mixed dentition period, late mesial shift. Leeway space deficiency may be seen in some individuals when size of unerupted premolars and permanent canines are larger than the space available. Eruption of permanent second molars. Emergence of second permanent molars ideally should follow the eruption of the premolars. If the second molars erupt before the premolars erupt fully, a significant shortening of the arch perimeter occurs, and malocclusion may be more likely to occur. Change in the anterior-posterior molar relationship in mixed dentition. To begin with, the newly erupted permanent first molars occludes in a cusp-to-cusp relation, especially when deciduous dentition exhibits flush terminal plane. Cusp-to-cusp or end-on molar relationship, which is considered normally in early mixed dentition stage, changes into class first molar relationship, which is considered normal in permanent dentition stage by the following factors: leeway space of nuance, differential mandibular growth. Differential mandibular growth. During growing period, both the maxilla and the mandible grow downward and forward. However, the mandible grows relatively more forward than the maxilla during this developmental stage. Such differential mandibular growth is through to contribute to the transition from end-on to class first molar relation. Permanent dentition stage 12 years and beyond. Permanent dentition stage is well established by about 13 years of age with the eruption of all permanent teeth except the third molars. Permanent successors develop from lingual extension of the dental lamina, successional lamina, and the permanent molar develop from the posterior extension of the dental lamina. The permanent incisors develop lingual to primary incisors and move labially as they erupt. The premolars develop below the divergent roots of the primary molars. Permanent dentition begins to form at birth, at which time classification of the first permanent molars becomes evident. Sequence of eruption of permanent dentition is more variable than that of the primary dentition. In addition, there are significant differences in the eruption sequence between the maxillary and the mandibular arches. The most common eruption sequence for maxillary and mandibular arch are presented on this slide. These are also the most favorable sequence for the prevention of malocclusion. It must be noted that there is a difference in eruption timing of the canines in the two arches. In the mandibular arch, the canines erupt before the premolars, whereas in the maxillary arch, the canines generally erupt after the eruption of premolars. When second molar erupt before the premolars are fully erupted, significant shortening of the arch perimeter occurs due to mesial migration of permanent molars, increasing the likelihood of malocclusion. Characteristics of occlusion in permanent dentition. Some of the characteristics of the normal occlusion in the permanent dentition stage are listed below. Overlap. The maxillary teeth overlap the mandibular teeth both in labial and buccal segments in centric occlusion. Intra-arch tooth contacts. With the exception of the maxillary third molars and mandibular central incisors, each permanent tooth occludes with two teeth from the opposite arch. In other words, each permanent tooth has two antagonistic teeth. Angulations. Permanent teeth have buccolingual and mesiodistal angulations, whereas the primary teeth are generally vertically positioned in the alveolar bone. Arch curvatures. The anterior-posterior curvatures exhibited by the mandibular arch is called the curve of Speer. It refers to the anterior-posterior curvature of the occlusal surfaces, beginning at the tip of the lower cuspid and following tip of the bicuspids and molars, continuing as an arc through the condyle. If the curve were extended, it would form a circle of about 4 inches diameter. The corresponding curve in the maxillary arch is called the compensating curve. Incisor relationship. The vertical overlap between maxillary and mandibular incisors is called overbite and is about 1 to 3 millimeters, and the horizontal overlap, called the overjut, is generally between 2 to 4 millimeters. Normal relationship for molars. In permanent dentition stage, the class first molar relationship is the ideal relationship. In class first molar relationship, the mesial-buccal groove of the mandibular first molar is in the mesial-buccal cusp of the maxillary first molar. Dr. Andrews in the 1960s performed a study. As a result, were formed 6 keys to normal occlusion. Key 1. Molar relationship. The distal surface of the distibuccal cusp of the upper first permanent molar made contact and occluded with the mesial surface of the mesial-buccal cusp of the lower second molar. The mesial-distal cusp of the upper first permanent molar fell within the groove between the mesial and middle cusps of the lower first permanent molar. Key 2. Crown angulation. The mesial-distal tip. The term crown angulation refers to angulation or tip of the long axis of the crown, not to angulation of the long axis of the entire tooth. As orthodontists, we work specially with the crowns of teeth, and therefore crowns should be our communication base or referent, just as they are our clinical base. The gingival portion of the long axis of each crown was distal to the incisal portion, varying with the individual tooth type. The long axis of the crown for all teeth, except molars, is judged to be the mid-developmental ridge, which is the most prominent and centermost vertical portion of the labial or buccal surface of the crown. The long axis of the molar crown is identified by the dominant vertical groove on the buccal surface of the crown. Key 3. Crown inclination. Labiolingual or buccolingual inclination. Crown inclination refers to the labiolingual or buccolingual inclination of the long axis of the crown, not to the inclination of the long axis of the entire tooth. Key 4. Rotations. There were no rotations. Key 5. Spaces. There were no spaces. Contact points were tight. Key 6. Occlusal plane. The plane of occlusion varied from generally flat to a slight curve of Speer.